Today we'll have a short lecture on the elbow and the radial ulnar joints, the structures and their functions. The first aspect that we should look at is going to be located on the humerus. When we look at the medial epicondyle, this is going to be the origin for all of the flexors of the wrists and the fingers. And then when we see the lateral epicondyle, this is going to be the origin for the extensors of the wrist. Some other important aspects when we look at the humeral ulnar joint is going to be the trochlea, so the connection between the articular cartilage on the medial side of the humerus with the articular cartilage or the plateau that's located on the ulna. The majority of articulation with elbow flexion and extension is going to come from this connection between the trochlea and the coronoid. When we go over onto the articular cartilage or the surface of the humerus on the lateral side, we see the capitulum and the head of the radius. But what we also notice is that there's a direct space between these two. So the capitulum of the humerus and the head of the radius do not actually articulate with each other. They're in the position, but we don't see that direct articulation that we notice with the trochlea and the coronoid process. The majority on the lateral side of articulation is going to be with the radial ulnar joint. So the radial ulnar joint consists of the head of the radius with the ulna. So some key bony landmarks that we should also look at from a lateral view is going to be the olecranon process, and coordinating that the olecranon process, which has the trochlear notch, where the humeral head or the trochlea comes into the position of the ulna. And then also we see the olecranon process, and this is the olecranon process is on the ulna, and then we see the olecranon fossa, which is located on the humerus. So when we go into extension, we see the olecranon process articulating into the posterior surface of the humerus into the olecranon fossa, which allows for the joint to be able to lock out. We also see different tuberosities or attachment points. We see the radial tuberosity and the ulnar tuberosity, and these are going to come into importance, these structures, when we start looking at supination and pronation. So one of the things that we look at is the ability to have the locking out principle. So as mentioned before, the olecranon fossa is going to have its contact with the olecranon fossa, or the olecranon process will have its contact with the olecranon fossa, which will create a lockout. We see that once the elbow flexes at about 20 degrees, which is going to be primarily the job of the brachialis, which is the true flexor of the elbow joint, that 20 degrees allows for side-to-side laxicity, and this laxity is going to be the ability for your forearm to slightly AB or abduct. With this side-to-side laxity, we see that unlocking, and that unlocking or the ability to do that is going to come from the olecranon process, moving away from the olecranon fossa, which causes the stability to decrease and allow for the ulna and the radius to do AB or abduction. So stability in flexion is going to then, once the elbow goes in to flexion, we see that stability in flexion is going to be primarily from the radiocollateral ligaments and the ulnar collateral ligaments. And so once we go into flexion or at 20 degrees, we are going to see the stability decrease and the reliance on stability from ligamentous support. Also, this is a diarthroidal or a diarthroidal joint which contains this joint capsule or synovial joint, which allows for the elbow to produce synovial fluid. So as mentioned, once we go into flexion of the elbow, so once roughly we go into 20 degrees, we're going to be primarily wanting support and stability coming from the ulnar collateral ligament. Again, the forearm, once we hit 20 degrees of flexion, the forearm can go into AB or abduction, which causes these ligaments, particularly the ulnar collateral and the radial collateral ligament, the elbow has to rely on these ligaments for stability. So you can see here that the ulnar collateral ligament is located on the medial surface. So we have the medial epicondyle of the humerus connecting into the lateral surface of the coronoid process. We also see vertical striations here coming down to the olecranon process, and we also see a horizontal striation. So we see these three that are going to be protecting the elbow stability and flexion. This ulnar collateral ligament, this can be replaced by the palmaris longus tendon, so the tendon of the palmaris longus muscle. 21% of individuals are missing the palmaris longus tendon, but we use the tendon from that muscle to recreate or surgically repair this surface in case it's damaged. Most of the time we see throwing activities such as baseball and softball that produce the most wear and tear on the ulnar collateral ligament. The other one for support during flexion is going to be the radial collateral ligament. So when the forearm or when the elbow is in flexion, we're also going to rely on the medial surface, or excuse me, the lateral surface of the radial collateral ligament, and it's just helping to hold the lateral surface of the humerus with the ulna. So when we're looking at total flexion should be roughly at 150 degrees, particularly when we're looking at flexion of the elbow. One of the prime ways that we check flexion of the elbow is with an open hand is, are you able to bring your thumb to the anterior surface of your deltoid? There's many factors that can decrease flexion of the elbow. If we see tightness through the triceps, if we see overdevelopment of the bicep, can also reduce the total flexion of the elbow. Extension, sometimes what we see is hyperextension, and the reason we see hyperextension is just that the olecranon fossa is a little bit deeper, so the olecranon process is going to travel deeper into the fossa, which produces the hyperextension. So the other joint besides the humeral ulnar joint is going to be the radial ulnar joint. This is a pivot joint or a trochoid joint. It's basically remembering the main point that the ulna is going to remain fixed. So when you're talking about pronation or supination, we're particularly looking at the radial tuberosity and the rotation of the head of the radius. So here's the illustration. We see the head of the radius inside the radial notch of the humerus here. And when we go into supination and pronation, we're going to see supination and pronation going to occur in two spots. We're going to see it more proximal. We're going to see articulation at the radial head, and on top of it, we're going to see it more distally at the ulnar notch of the radius. So when we do go into supination and pronation, we see distal or proximal and distal articulation occur. This rotation of supination and pronation, when we're looking at supination or palms facing up, we should be able to see it going back into a neutral position, roughly at about 90 degrees. And then when we're talking pronation, we're moving the radius over the top of the ulna, and that's why we see that the range of motion sometimes decreases. Pronation is usually slightly dysfunctional in individuals with tighter than normal extensors or extensors of the wrist. So the posterior surface of the forearm usually becomes tight in individuals such as climbers or bikers, anything that involves the grip. We see that individuals lose the ability to pronate a little bit more effectively. So there's a synergy between the glenohumeral joint. Mainly the purpose of this slide is to just show the synergy between the glenohumeral joint and the elbow and the action of the radial ulnar joint. So pronation and supination. So as the radial ulnar joint goes through its ranges of motion, the glenohumeral and elbow muscles contract to stabilize or assist the effectiveness of the movement. So the best example of seeing this is tightening a screw with a screwdriver. When you are doing that, the main action that we see is going to be radial ulnar supination, so palm facing up. But when you're producing that tightening the screw with a screwdriver effect, what we see is that at the glenohumeral joint, we're going to have external rotation. And we're also at the elbow joint, the humeral ulnar joint in particular, we're going to see flexion that occurs at the elbow. The opposite is going to occur with the synergy between the glenohumeral, elbow, and radial ulnar joint when we conversely talk about pronation. So loosening a tightened screw will be the opposite effect. We should see internal rotation at the glenohumeral joint. We will see pronation at the radial ulnar joint. And we should see extension at the elbow joint or the connection of the humeral ulnar joint. So the main purpose of this slide is just to put into emphasis the position of the ulna. So when we are talking about pronation and supination, the ulna is always going to remain fixed. And the next illustration we see during supination and pronation, we see the radius moving over the top of the ulna. And just as a review, remembering that we see pronation and supination of movement at the radial ulnar joint occurring at both the proximal and the distal ends. So we have the radius moving over the top of the ulna in 2 points. One of the things also we should be aware of is the origins. So the origins are always going to be on the ulnar side. So when you're talking about origins and insertions with pronators and supinators, the majority of the origins are going to occur, such as in the pronator teres, and when we're looking at the pronator quadratus, these are all going to have their origins on the ulna side, and therefore their insertions are going to be on the radial side. So the first one we'll look at are the pronator teres. We can see that the origin is going to be on the humeral and radial side, and then the insertion is going to be on the radius side. When we produce that movement, we should see the radius moving over the top of the ulna. The other one that's a really interesting muscle in this group is going to be brachioradialis. Brachioradialis is really interesting because it's going to produce not only moving from a neutral position into pronation, but we're going to see it moving from a pronated position back into the supinated position. So the brachioradialis is actually involved in both pronation and supination. The other important muscle that we should look at, and that's what this little illustration right here is doing, is it allows, the bicep brachii is most important with supination. So when we're in a pronated position and we go back to supination, we can see that the tendon of the bicep brachii is attached to the radius and allows for a rolling action of the radius to pull the radius back into its neutral position into supination. And finally, one of the things that we look at, or we have been looking at, is with the shoulder girdle is the function of the pectoralis minor. The function of the pectoralis minor is for depression of the scapula. We also talked about this muscle being dysfunctional, losing the ability to depress the scapula, which causes the scapula to be malpositioned. And on a myofascial tissue, we can see how the myofascial tissue, if that pec minor is malpositioned, can affect the bicep brachii, which then can affect a brachioradialis, which can then affect both supination and pronation. And we see going down, it can affect eventually the closure of the thumb, which is important for gripping and grasping. But most of the time what we see the dysfunction occurring is through the bicep brachii. The tension that occurs in the bicep brachii from overdevelopment can lead to changes through the elbow joint, the inability to completely extend the elbow joint. It can also affect the brachioradialis muscle, and essentially it can affect the grip. Here we can see the superficial arm line where we see the pec minor or pec major coming in. The myofascial tissue can go down into the medial side of the forearm, which then can directly affect all the flexors of the hand. So myofascial tissue is going to play an important role when we're looking at under and overdevelopment with the muscles of the elbow. And again, they are just linked to the shoulder girdle and the shoulder joint also. That concludes the structure and function of the elbow joint or the humeral ulnar joint and the radial ulnar joint.